Appreciate everybody joining in. Obviously, as you can see on my screen share on here, compliance is the conversation today. Compliance is something every behavioral health organization deals with, no matter if you're on the direct care side, middle management, all the way to executive. But many teams don't realize where the real operational gaps are, right? Until an audit happens. Today, we're going to talk about what actually causes those gaps and how organizations can move towards continuous readiness on here. And I think just some intros. I think for some of the folks I see the attendees on here, I'm sure my name, along with Erica's name, maybe you guys have been in an email chain with us or a Zoom call or a phone call. Maybe I've cold called you before. But I promise I will say, set the record straight. I am not the compliance guru here. I'm just, as you can see, the conversation guru, not compliance guru. So with me today, obviously you guys know Erica, an all-star on here. She will be assisting me and you guys in this conversation around compliance for many reasons, which I'll touch on in a bit. But compliance experience and real world stories by Erica on here. So um, and by the way, just to set the maybe I set the stage here, we do have a Q&A option down below. So for the folks that joining in our webinar here, if you all have questions, feel free to float all those questions down there. We'll be reserving the last 5 or so 10 minutes at the end of the call, going over those questions. So appreciate you guys. Appreciate you all joining in on here. So I will go over to the next slide just to tell you all what the agenda. So agenda today, hey, what we're the real cost of compliance in behavioral health, number one. Number two, where the gaps actually live. Hint, it's not where you think it is. And number three, why binders and policies don't create accountability. I'm sure some of you all in your offices have binders right next to you in regards to compliance. We'll address that. Number four, what true audit readiness looks like on the day to day and possibly even long term as well. Number five, moving from reactive audits to continuous readiness. And lastly, why now? Like, and what's changed with AI, especially really in us being on the SaaS side of the industry, AI is changing the landscape. So we'll definitely touch on that. I know that's a hot button topic that everybody wants to touch on. So, uh, Erica, I'll tee it off to you. I know I've been talking a lot on here. I'll give myself a little bit of a water break, but mind introducing yourself a little bit, and then at the same time, maybe touch on kind of like the origin of InCheck and what we're talking about today.
Absolutely. Thanks for the intro, John. So my name's Erica Ward. I'm a product manager here at Alleva, but I initially started in the behavioral health industry as a client of Alleva's several years ago. About almost 4 years ago, I made the jump over into Alleva after being basically all roles within a facility. Started out as a knock BHT and worked my way up to case manager and then became a director of quality and compliance, as well as having my own compliance consulting agency where I went around and helped clients obtain joint commission and state licensing and CARP and things of that nature. So I'm very familiar with compliance. Then when I segued over to Alleva, I started off in the operations department before moving to product about 2.5 years ago. And so when I talk about compliance, I not only dealt with it as a client, as a consultant, but then also I saw what our clients here at Alleva were going through on the daily, yearly, weekly basis. And that really kind of just touched on, why InCheck was important to me, why I felt we needed to prioritize and build InCheck in the first place. And so InCheck actually isn't a new idea. I came up with it. We used to have these things at Alleva called Fun Fridays, right? Where you could dedicate the last half of your Friday to something that you were passionate about. And having seen the struggles that I went through and my current clients were going through, I was like, we need some type of content management system to keep everything in one place, especially facilities that might have multiple locations or, they have things like scattered about on the same property. What can they do, like from administration to executives? Like, what can they do to all keep it in one place? And so for me, InCheck was kind of the solution to that, as well as like trying to cut down on operational costs and things like that. Um, uh, John, if you want to get into like the the burden
Yeah.
and the reality of cost and
Yeah,
stuff like
definitely.
that.
And I appreciate you kind of touching on your, honestly, a unique background. I mean, I talked to so many folks in the industry. I think what's great about your experience, Erica, and then now coming on the vendor software side, supporting our clients, is that you've seen it all from different angles on here. And to your point, like we have these like Alleva Fun Fridays where really it's dedicated to us brainstorming, thinking outside the box and how we can support our clients better. And I think
Mhm.
your experience definitely led into the origin of InCheck, right? That kind of like that product story behind it. So, I mean, you've seen, Erica, like these operational challenges up close. And that perspective clearly played a role in creating InCheck, to your point of all the different roles that you've been in. I mean, a few questions kind of like that I have in mind on here. It's like, hey, what was the moment when you realized something like InCheck needed to exist? I feel like there could have been many different stories for that, but like for you, like what was that moment like?
For me, right? So compliance is at the core of everything we do. But the whole reason why I came to Alleva and why I love Alleva so much is the vision for me has always been to give clinicians more time with their clients. That's what it comes down to, right? And when they're stuck doing the paperwork and making sure they're checking all the boxes for compliance, which compliance is super important, right? Through it, you gather outcomes, you improve patient care and things like that. But if there's something there that can help automate that or streamline it or make that data more digestible, then you can spend less time doing it and you can actually implement it faster with their clients. And so that's kind of where the whole circle of in check, like
Right.
filling out the forms and all that stuff and like making sure you're checking all the boxes and you're fixing all the things, which we'll get into in a little bit, is super important. But it mainly comes back down to everything we do here at Leva is we want clinicians to have more time with their clients because that's where those special moments happen. They're not happening when you're documenting a life and safety walkthrough.
Sure, definitely. And also like I think maybe to set the stage too for our audience, our attendees on this webinar. I mean like maybe like let's jump into the industry, right, Eric? I mean like for me, when I t think about compliance, it's so many different things. I mean,
Mhm.
originally I'm used to only talking about compliance on the EMR side, obviously providing EMRs to the industry, but really, like compliance means a lot of stuff. Compliance is a lot in behavioral health, yet alone healthcare in general, and then behavioral health.
Mhm.
There's specific nuances that go hand in hand with that. I mean, like I think for the audience team members on here, some of you all may already know what InCheck is. For those that have not heard about it or have not to talk to anybody at Alleva about it, it's like hey, like this is everything under the sun outside of the EMR compliance. A lot of things that go hand in hand with it. Most behavioral health organizations don't realize how much time and revenue compliance quietly consumes until an audit reveals the gaps. I think that first sentence on my screen on here feel like resonates a lot with a lot of the conversations myself and the rest of my team have been having with our current customers and also prospects that we're talking to. Accreditation is also considered a hallmark of quality, building trust with clients, references, and payers as well. Eric, I have a question for you. From your experience working in the industry and working at programs yourself, what are some of the compliance challenges organizations deal with every day that people outside the industry might not realize?
So some common things that they might encounter from day to day, um, a client incident where they have to document, or just a facility incident. Like what if there's something within the organization, and people, organizations tend to be really good about documenting when the incident happened, but where's the follow up?
Mhm.
How are you documenting that corrective action? And so they're good at doing the initial steps, but there's no follow through. And so that's when they find themselves like, where's the documentation for that? And
Sure.
then, and that flows into a lot of it is like they'll start, but then where does the documentation?
Right. And I assume you're probably talking about, I think the two words that I hear from prospects a lot and current customers are deficiencies and gaps, right?
Mm-hmm.
Where
Yeah.
do you tend to see the biggest operational gaps are?
So it just depends on the facility. Like not, I mean, like an outpatient might not have med management and things like that. But sometimes you can't identify a gap until you're in with an audit. And so this enables you to have that continuous compliance, especially as an executive. You want a viewpoint of what you're looking at and things that you're looking forward. But like it really structures it down. Within in check we have this gap analysis, and what it does is it takes all of your answers and identifies pain points and weighted scores for each area, so you can go in and be like, okay, I know that my chart audits need to be, I need to take a look at my chart audits and see, do I need further training? Do I need, and then you can make that connection and that flow. So you can say, oh, well, in January, my chart audits were at 73%, and my threshold is I want them at 95. So for February, I went through training all of this. And the gap analysis analyzes that, gives you the overall, but then also breaks it down by different items within joint commission or within your
Sure.
state licensure and things like that, and really hones in on where you can spend your time focusing. And that can shift like your trainings that you do with staff, or how you offer support to your staff, and which staff you offer that support to. So it saves you time because you know where to focus your energy on.
Sure, definitely. Make good point on there. I want to maybe have you put your hat on that. You mentioned at the beginning of the call you did some compliance consulting, so working with multiple different organizations, not just at the program that you worked at. So if you don't mind putting that hat on for me, my question is like, hey, what are some things organizations that you've worked with, Erica, think they have covered that audits often reveal they don't?
Yeah. So one thing that I found in consulting is they'll have this beautifully written policy and procedure manual, right?
Hmm.
But then they go off script, right? They're doing things as things have evolved, and either they haven't updated their policies or they've just made way. And that's one thing with compliance. Your policy and procedure manual is your script for what you should
Right.
be doing and how you should be doing it within the facility. If something changes, you need to document that. That's why, like the annual policy reviews, sometimes people do it quarterly, and you're updating them as requirements and things change. Um, and it that kind of just levels it up into that, is like the documentation, or they'll miss a key piece of documentation. Say there was like a med reaction that they didn't document, um, and so the documentation doesn't necessarily create accountability. Like I can fill out all these incident reports, I can fill out all these forms, but if I'm not doing any follow up on the things that I found were deficient, then what
Sure.
am I doing? Right. The it stops. Right. And so the one thing that I really, really like about in check is that what it does is it takes your policies, because policies vary from facility to facility, and even sometimes like within an organization, depending on like the county or the state that the facility is in, it can vary from organization because you have to change as per the state requirements, and then level of care requirements as well. And you know, InCheck uses Policy IQ, which is an AI powered to scan your policies, and it'll actually create the events so you can make sure that you stay on task. Um, and the other thing too is this gives users access to the policies at any time. They don't have to go look for the policy and procedure manual in the offices or wherever they keep them, because we all keep one, but where are they, right?
Right.
They're massive documents, and this gives them all you know, at the tip of their fingers, and they can search for them and have them all, accessed,
Sure.
um, right there. And so by doing this, this allows the policies to actually correlate to the standard and create the events. So you know that from the policy, you're actually hitting all these things and you're following your policy. And then it flows into like you actually complete the items that the policy has indicated you to complete. And it's going to indicate based on your answers what needs to be corrected from there, which then creates that circle and goes into your gap analysis and helps you
Sure.
identify again where those deficiencies are, where you can spend your time, and, really hone in your time as, a compliance officer or whoever operational manager, and focus on those things that
Sure.
you need to.
I mean, kind of like now, which I love that you brought up. Sounds like operational breakdown, right? At programs. I have a quick question, follow up with that one, with your discussion there. One thing I think a lot of organizations say is that, often with documentation, you mentioned policies, procedures, those three-ring binders, uh, but they struggle during these audits. Like, why is it, Erica, like documentation alone? Why doesn't documentation alone create accountability?
So operation or documentation alone doesn't create accountability because as we've shifted over the last, I'd say 10 years, right, towards this outcomes, right? Documentation is great. You've recorded the incident, but what are you doing to fix it, right? It doesn't have that correlation to move forward. And you don't have a great way to document how you are moving forward.
Hmm.
And so having it all in one system in this content management system actually kind of pulls forward and allows you to correlate, okay, so we're going to improve this, we're going to do trainings, and then the correlation between the two and the outcome that we're tracking is that our documentation skills went up 15% over the last 3 months. It
Sure.
allows you to pivot earlier and make the corrections faster before they become an even bigger problem, which we all know, right? If you're only doing, you're only getting set up and ready, a few months before your survey or before licensing comes in, it it takes away from the changes that should have been occurring all year long. And that
Right.
really pushes into, that continuous compliance piece that um we really need to be focusing on. I've worked with facilities where they'll you know, they don't do anything for 2 years, waiting for licensing to come in. And then they're scrambling, and
Hmm.
their clinicians and their compliance people and their operations manager are all stuck making sure that everything's up to par 3 months before an audit, but they're missing the clients that are right there in front of them. And
Right.
instead of just giving them an easy tool so they know they can stay on it with alerts and, email alerts and text alerts, and it's a quick and easy win in my eyes, at least. And then as executives, you can check in on these compliance things at any time. You can
Sure.
literally open and check and see, where is everybody at? What's my gap analysis look like? Do I need to step in and run interference, or why isn't this being handled? What is the person who's in charge of this working on else? Maybe I can go in and better support them and their role.
Sure. Yeah, that makes sense. I mean, you kind of touched on like some of the current day to day right now of what's happening in the industry. Some of my friends that own programs, I'm sure they're kind of they can resonate with what you just mentioned. And by the way, like at no point at all is this should you make you guys feel guilty with this? Like, I think for Erica being on the used to be on the front lines, similar to you all. Like this is the reality, I think, which follows up to like my follow-up question, Erica, like, hey, what operational systems, right, actually need to exist for compliance to work day to day, to help support the industry and our
Mhm.
customers?
Um, So I think it comes in twofold. Like, obviously, our clients have to be flexible, right? Because we never know. Like, they could have an AMA, you could have a crisis that you have to attend to. Um, but as far as like what needs to kind of really happen is, a lot of people manage a lot of these things on spreadsheets and,
Mhm.
like we've mentioned, the binders, right?
Yep.
And that's all dependent on people entering that data into spreadsheets. Now they can use forms to pre-insert them, but that's still a lot of manual work that users have to do. Um, and for me personally, I want everything in my face. I just want it there so I can complete it. It'll tell me what to do next, and so that I can just button it all up in one fell swoop, or I can come back to it if something pulls away my attention. And that's the other thing too, is the nature of the behavioral health industry. Like things can change. Like you can be in the middle of a walkthrough, and you may have to go attend and have to come back to it later. If you're in a spreadsheet, you have to go back and find your spot, and um,
Right.
and then, like, did I forget things that needed to be fixed up above? Do I need to get those assigned? Do I need to add these to a spreadsheet? And so it takes a lot of effort on the individual's part completing these tasks. And then on top of it, you're worried about clients' care. And that's, I want to give them back that ability to care for clients fully.
Sure, definitely. I mean, it's really accountability. It sounds like where like people need to be audit ready at all times, right?
Mhm.
It's really what matters. And when organizations are truly operationally audit ready, Erica, how does that look like in practice to you?
So audit ready means you're not, it doesn't mean that you're perfect, right? No facility is perfect. And we all have been there when we've gone through surveys where I can't tell you how many surveyors, and I have great relationships with a lot of surveyors, but they're like, we're just here to educate you, right? They're going to pick apart things. So it doesn't
Mhm.
mean perfection, right? In my opinion, audit readiness means you're better than you were yesterday, right?
That makes sense.
And so accountability is built into in check the way I had always hoped for. Like you have incident management. On the slide, you can see we have built-in workflows for the different types of incidents where it will literally trigger everything you need to do. So your investigations, it'll trigger who you need to report it to. It will allow you to upload documents to it. So it's all in one place and it's all readily available. So if the state does come in or JACO comes in and you have to report it, you can just be like, oh, here's the entire file. It's tracking your timelines to make sure that you're hitting those 45-day or whatever your state requirements are, um, for reporting. It's automatically alerting those who need to be made aware of those incidents. And it's fully integrated in the EMR. So you can have your BHTs or whoever make your incident, you can sync them over and check and then handle it at an executive level where people might not need that visibility. So it's also offering that level of privacy. Um, and then the other thing too is you can see here we have that corrective action workflow. Throughout the entire system, we have these forms built out, and uh, as you mark things like deficient or not, it's going to automatically trigger this deficiency and corrective action response. So what you marked, it's going to automatically flow in. You'll be able to assign that to the responsible party. So they'll get that on their task list. They'll get the alert or the email saying, hey, you have a new task that you need to handle. They'll send them alerts until it's coming up to their due date. And then you can create additional follow-up tasks based on that. And so it really is closing that gap. And then of course those follow-up issues and those corrective actions all flow back into that gap analysis. So it's really closing the circle without us having to think about it, right?
Sure,
And
sure.
then, again, those outcomes, you can improve client care, you can improve organizational functionality all directly in there. You know, the other portions of it too is like we have the built-in chart audits. We have your life and safety walkthroughs, we have temperature logs, we have emergency drills, all of that built in. So it just automates. It's on a calendar. You can see things in advance instead of having to, you know, take a look. You have your maintenance logs,
Mhm.
which you can upload. All of that is within in check, just so you have it all in one place, right? And so that makes it easier too, instead of having this here, because everybody might own different pieces of it, right? Your operations person might be in charge of life and safety, but your clinical team is going to be in charge of your chart audits. And so having it all in one area, it allows it all to come together, and it helps you make a better decision, seeing all the pieces of the puzzle instead of having to separate them into different spreadsheets and things like
That makes sense. I mean, like I'm
that.
still trying to rewire my brain I mean, this really is goes beyond the EMR, right? Like,
Mhm.
plenty of things. Obviously, you all know this of compliance. It's not just the EMR, but like at least for in terms of Alleva, this is us helping support you all outside of the EMR compliance with all the items that Erica had just mentioned. I'm curious, Erica, like how does that change how organizations approach compliance on the day to day?
Um, I've met and when I was a consultant, things like that, I've heard a lot of times that, staying up on compliance is a chore, right? And when we think of compliance as a chore, it's not allowing us to use that data to improve and make things easier for ourselves. And so, you know, InCheck allows users to easily stay up on it. Like if you have access to a phone, you can log into InCheck. That's the beauty of it. Fully mobile responsive. You can go through an iPad. You can have users sign in for trainings. It makes it easier to stay on task and to push forward with what you really find important. And then you can make those actionable choices day to day on what the data is telling you, right?
Hmm.
And so that's what makes it neat. And it's outside of the EMR. So you can always bring in what you feel is important. You can choose which items you want to bring forward and make those daily improvements. Again, like I said earlier, it's all about, I just want to be better than yesterday,
Yeah.
you know?
You make a good point on there. And I mean, for me, I like talking to prospects and current customers that we talk about. And you mentioned this earlier too, like compliance. It's yes, it is in a day to day, but it's technically an all year round item as well. Erica, like, what
Mhm.
about like long term? Like, what does this mean long term?
Um, it really means, in my opinion, this continuous compliance piece, it 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 enables you to save money, right? Because you're
Hmm.
not spending all of that time. You're offering better client care. That means, better client retention or referrals, things like that. It allows you to focus on, again, client care. That's super important. And improving things. The behavioral health industry is constantly changing. Um, it changes, and especially within it changes from, federal guidelines to state guidelines. Some states even break it up by county. And staying up on all of that can be daunting. I remember a few years ago, they had added just two questions to a health questionnaire. They were just yes or no questions with signatures. And I know a lot of facilities missed that addition. And so when they went to go, because it was just a press release, it wasn't anything like majorly announced. But when they found it, they got a deficiency for not including those on their health questionnaires. And they were just two simple questions. Um, and so this enables you to, keep track of those policies and those standards that are established, and then put them into action and show like, okay, I put them into action this day. And then you can easily just show that to your surveyor or, the person doing your licensure review and move forward with it. It, it all creates this continuous compliance. The alerts are telling you have this task to do, you have it on this due date. Um, it pulls from the standards, which are correlated to your own policies. Um, and then you're using your life and safety forms, your emergency management forms with drills and things like that, and response times, along with your chart audits, and using those corrective actions to shape the gap analysis. So it's creating this gigantic circle of compliance. And that to me is what continuous compliance is. Like you're always staying on top of it. Because I don't know how many of the audience members have ever been a part of a company where, you're scrambling and you get all nervous when you know that joint commission is going to come in. This takes away some of that anxiety because you're prepared with what you have. You're not searching for, outcomes. You're not searching for, I needed to do my checklist. Like you can create checklists and, I need to pull my survey results and make sure that I have them, in check. And you can have little reminders and text messages. And it's just helping you stay on task because we get pulled in 8 million different directions when you work in treatment. That's the nature of it. And a client care issue comes up first, compliance comes second to that. And
Yep.
this enables you to come back to it and remember what you were on task. Um, and so it takes the guessing game out of it.
Yeah. No, I love that point. It's almost like you can do your own survey all year round, right?
Yeah.
I think that's kind of like a really good overall summary of it. And I think to your point, it's like, like this full circle, a very well-rounded approach across standards, policies, the gap analysis, corrective actions, life and safety, and really just the continuous compliance around things, which brings me to my next point of like, it sounds like this is pulling people away from a very reactive manner. I mean, I have
Hmm.
friends that own programs out there and like, yeah, like the fact that clients come in first, compliance comes in second, really anything comes after clients is kind of sometimes dealt in a very reactive manner. So, many
Hmm.
organizations approach compliance, this is the number two priority after clients, reactively, preparing for audits when they know one is coming, Like Erica, what does it look like when an organization moves to continuous readiness instead? What does that look like?
Um, for me, like what you were saying before, right, where we have like continuous audits all throughout the year, it's that always audit ready year round. You're accountable. Like it comes back to what we were talking about earlier with accountability, right? You're always going to be accountable and you're always going to be on task and you're always going to be making that those continuous improvements all year long. So you're going to be better than you were yesterday, the previous week, the previous year. The other thing too is it's taking that, one connected system. I remember I would have, my EOC walkthroughs at one facility, but then I'd have to go to the next facility to make sure that my operations manager was completing them there. And then I had to take that data and pull them together while doing, the full chart audits and like the quarterly reports for the executive summaries and things like that. And this puts it all in one place. You have one source of truth. So, it gives leadership visibility as well. It's letting them know, hey, there's a risk here. I've identified that this facility on their EOC walkthroughs consistently has broken windows. What's going on there? Right?
Sure.
Is it the neighbors? Is it the clients? Is what's going on? How can we help and better this situation? Um, you know, and it all flows down to it's compliance is operational. It's not ceremonial. And um, you just go through the test and you move on. But this allows you to do so with confidence because you know that you're doing the follow up. You're setting the standard. You're setting the follow up for a week or a month from now, whenever you need to.
Sure, definitely. I mean, like some of the bullet points on here that we wrote up on our PowerPoint. I have a follow-up question on like because especially I look at the attendees on here. I know some of the names on here I'm familiar with that are either in leadership or middle management at their programs. Like, how does operational visibility, Erica, change how some of these leaders that we work with manage compliance risk?
It allows you to fix the issue sooner, right? I don't know if I haven't looked at who's actually attending, so I can't comment. But one thing we have, I'm going to bring this back to Alleva really quickly. We have this excellent clinical compliance dashboard and insights, right? That is my bread and butter. When I worked in treatment, I used to use that. And I actually used to use that to send out reports to say, hey, you as a clinician or you as a BHT, your documentation isn't on time. It's giving this score, or you're not getting your treatment plans documented on. And I would just have to send it out to them. I would send it on an automated report, right? And it saved me time. It also saved the clinician or the BHT their time because they had all of their notes and everything documented. And they were like, oh, she can see this really quickly. I need to stay on top of this. I need to make sure that I'm doing this well.
Sure.
And for me, like that saved me time. It saved, the pressures of having to go talk to some of these clinicians. But then if someone was really struggling, it allowed me to build that rapport with my employee and be like, hey, you know, I I see that you're struggling. What can I do to support you?
Right.
And that's what it all comes down to, like in check allows leadership to get ahead, see the trends, and offer support where they can, right? This is a team effort, it's not a one person show in behavioral health. It literally falls down from the executives to, clinical directors to,
Mhm.
they all play a very important role in everything that we do to care for these clients. And so it allows us to grow as a team too, like because we're supporting it, we're seeing it ahead of time before it becomes a major issue where we have to actually act on it. We can make subtle changes instead.
Sure, that makes sense. I mean, some of the customers I've talked to, they will literally show me Erica binders right behind them
Yeah,
on their
yeah,
desk, and
yeah.
which kind
They're
of which
massive. They're massive.
yeah, exactly. And there's so many of them
Yeah.
per type of like accrediting body or
Yeah.
topic that it addresses, which like just reminded me of the second bullet point on here. Compliance lives in silos. I mean, there's so many moving pieces in the
Yeah.
industry, right, Erica? Like it's really not just honestly on the management side, but it's also like who they're governed under, Joint Commission, CARF. All these different things, moving pieces. I mean, the industry is so fast growing and regulations, rules and regs are changing all the time. Erica, how are we supporting that?
So again, it all comes back to it's all in one place. Like, you know, with it changing fast, we built in this AI powered documentation. Uh, it's safe, it's HIPAA compliant, it's maintains the same, structure and security features that we have built into Alleva. And then the main thing is it's an all-in-one solution. You can have clinical in the clinical area. You can have,
Mhm.
operational, whoever is in charge of HR, be in HR and not have to worry about, oh, clinical, we can see HR, we can block them from seeing it, but it all pulls in together on one report so that we can act on all of it together and see that beautiful big picture. If you need to bring in legal for an incident report or something like that, you can do that easily without having to worry about, looking at everything else. But then you can also connect it, right? If an incident, that happened during clinical care gets reported on, you can then link it back to a training and follow up those corrective actions and add that back into the incident report. So you can show the steps you did
Sure.
to remedy the situation. Um, and so for me, AI with the introduction of AI, it's super important that we use AI in a safe manner, right? We don't want to expose PHI, we don't want to break down HIPAA. And so making sure that we utilize the same tools that we have, like with Travis AI and New IQ or Echo, sorry, of what we do within there, making sure patient data is safe first, right? And then how can we take that safety and really push it forward to enhance our users' lives in that use. And so we do have that policy IQ where it scans, it also makes it a calendar, an event, and drill and chart audit suggestions. It'll make suggestions for what standards it needs to be, and then it'll schedule them at your discretion. Um, and then we also do. I don't want to talk too much about the future, but we do have some other AI
Sure.
initiated items in the future coming
Erica,
for
I
intro.
have somebody asked me the other day on a demo because like
Mhm.
clearly there has been a tool made for this gap, this current gap that they have in the industry without in check. Somebody asked me like, hey, compliance management, obviously this is not new in behavioral health, but Erica, like, what made this the right time to build something different?
Um, I think with trying to think how to answer this.
Curveball question. I know you know
Yeah.
everything, but I got you there.
Well, I mean, there's different ways to do this. First of all, I've wanted this for 3 years, right? This isn't something new. It's evolved over time. I initially had it like built out in Alleva, right? And you'd have the custom forms, you'd be able to do everything out. It really made more sense to build it as a separate platform so you can keep them separated, right? Um, but as the industry is changing, it changes, as we have new administrations and things like that. The different pushes we're seeing in the industry towards different things. It was really important to me that people have some place to be able to keep up on those changes as the industry things as things change. But then also improve and like if they need to, if they, say they have state licensure, but they want to go for joint commission, right? How are you going to easily do that unless you have somebody that knows joint commission in and out or you hire a consultant, right? Now, I'm not saying that you shouldn't hire a consultant, but what can you do on your end to help you improve? Well, in check, you can turn on and off those standards. So if you want to aim for joint commission and get prepared for your survey well in advance, which you have to do anyways, you can turn on those standards within in check and already start gearing up and identifying the gaps of like, okay, well, my state does this, but joint commission requires this. So I need to make changes and aim towards that for that survey. Same thing with CARP, or, the ever evolving landscape of, Medicaid, Medicare. Are there PHI concerns or there's a recent change and there's another one coming out this year for, um, part two and disclosures and ROIs and things like that. Like who's I know as a clinician who it's hard for me to keep up on that and stuff. And so like it just kind of flows into everything that you want. You want to push towards those goals, but to keep track of it all, when you're already doing the most important job of caring for clients that need your help, like or like this kind of helps you in that tool. It helps you stay on track of those things. It helps you move towards the next thing and aim better.
Sure, definitely. Um, and I know you touched on this a little bit earlier around AI.
Mhm.
Which I know it's like a buzzword, hot button item that I think a lot of our customers, people in the industry are either excited about or maybe sometimes a little bit anxious, right?
Mhm.
Around
Yes.
AI. Like Erica, like you engineering and building this tool for our customers in our industry. How is AI safe and compliant with InCheck?
So we don't store your data. We're not learning from it. It literally just takes your policies and it pulls in. And also right now, the only AI is on your policies. It's not on any client data. That's
Hmm.
the one thing about having it separated from Alleva is the only place that you're bringing in client data is through incident reports and chart audits right now currently. Um, and so you're not feeding any actual PHI into it. Now, obviously, you don't want everyone having access to your policies and procedures that you spent time and money, formulating and creating.
Hmm.
Um, but again, we don't store that. We don't use it to learn from. It simply scans it and then it forgets it. It's articulating what things are matching at what percentage, and then it's giving you suggestions on what you should do.
Sure, definitely. That sounds great. I mean, now reflecting on it, I've been talking to a lot of our customers since December.
Mhm.
I think, yeah, since December, showing them the product. Lots of customers have come on board with it as well. I think for the folks that are on this call too, I think the feedback's been great. I don't know if Erica, if you're, I think I've told you this too, in some sidebar conversations after demos. I think one that I actually added on our slide deck on here, one of our customers, they're out in Illinois. I don't know. Let me see my attendee list. Maybe some of their colleagues are on here. Not too sure. But he before he joined the direct care side, working for a program as their compliance officer, he was a joint commission surveyor. So, I mean, I was honestly kind of a little bit nervous when I found that out 10 minutes into the call. But um, he told me that, like, one, first and foremost, the audits really depended on how much coffee he had. And depending on how good of a mood he was in, I'm sure some of you guys know this of like, again, they don't read every single thing on there, but uh, hopefully they're in a good mood and they can give you guys flying colors on things. But what he told me is, hey, from my time at the Joint Commission, I wish every program operated with a system like InCheck because I think for him, it it allowed him to come in to these programs, and these programs pretty much have can present to him what are they deficient on, what are things they're working on already. So it's been it's been a great I would say feedback loop from our customers on this one, the ones that have signed on with it and the ones that are currently still evaluating the platform. It's been a great feedback loop. I think the big key things on here is like, hey, the time saved on this one, and then also the policy completion rate with that AI support. It makes things a whole lot faster on this. Erica, on your end, I don't know if you have any thoughts on there. I spoke a lot about my experience talking to customers.
I mean, I the best part of my job is I get to interact with our customers regularly, and even people that aren't our customers, right? Because we want to make this better for everybody, not just our customers. Um, and um, I don't nearly do it enough, I would say. But
Hmm.
in talking to clients, they they see it, but change is hard when you're used to using spreadsheets and that's the way you've been doing it for 10 plus years. Making that transition over to something like in check, you're like, oh no, it's another software. EMR onboarding is not fun. I've done it.
Yeah,
I've switched. Um, but we've tried to make this onboarding process as smooth as possible by automating things, by making connections. So like you don't have to add all your HR employees, like it syncs your HR chart audits for you directly from the EMR. So we tried to eliminate as much manual items as we can, improving workflows so that you can get up and running very quickly within the system and start using it like a pro. And everything down to every little button and how it works has really been thought out, and like this click workflow to this click workflow and future
Sure.
improvements as well.
Yeah, definitely. I mean, I'm looking at the time here. I know we're almost 12 minutes left at the end of the
Mhm.
hour. I mean, just a quick reflection on here, and Erica, feel free to add some as well. I mean, like, we talked about a lot of stuff. You know, it's like obviously it's a one system approach that we're providing here, one source of truth. No long gone are the days of all these binders behind you that you
Yeah.
have to update manually. And it's also year-round readiness. This is not a, oh my gosh, we got our survey coming up in 2 weeks. We got our survey
Mhm.
coming up tomorrow
Yeah.
or in a couple days. Or I think another one that I've talked to is like, oh my gosh, I am new to the organization. I am now in charge of compliance, and I'm so busy trying to get to know everything they've been working on, or things
Mhm.
that they haven't been working on.
Mhm.
So, I mean, this tool really, but by no means is this a tool to replace your compliance officer or to replace your consultant. This is to shine a flashlight where things are deficient or you have gaps on. It sounds like this tool really is to get them to do a joint commission or carve survey whenever they want, right, Erica?
Mhm.
I don't know what your thoughts are on that as we're rounding up this conversation.
I mean, it really just boils down to, again, I'm going to circle it back to, it's giving you this all-in-one solution that's in one place, that's allowing you to track things, make subtle changes over time. And I do want to comment on the binder thing because I personally don't like binders. Obviously, some binders are required to be audit ready, but
Hmm.
if you like binders, you can easily just download the reports from here as a click on a button based on date ranges and put them in a binder if that's what you so choose. So you can have your binders too and in check at the same time. But what it really boils down to is it's giving you this all-in-one solution to make, data-driven decisions and link it back and improve care that will ultimately get you more time with your clients to provide better care. Because that's what it all comes down to, is providing the best care that we can to our clients.
Definitely, 100%. I mean, we've covered a lot today, you know, from industry challenges to how operational workflows can support continuous readiness. I do want to open it up. I want to keep my promise. I'm already 5 minutes late to my promise on here, but I want to open things up to questions from the audience. If they have any questions in regards to in-check, compliance, maybe Erica's background, any questions from the audience on here. Let me pull it up. Uh, Oh, Erica, like I know one question that people have brought up to me is in terms of implementation for this. Like, what is that process, and what materials do they need to bring with them?
So they need to bring their policy and procedure manual, um, broken up by policies. It's typically I believe it's like 5 or 6 weeks. You do one training a week for about an hour. Some of them where we go over like each intensive form is about 90 minutes. But it's pretty rapid and it goes pretty smooth throughout that onboarding process. Um, and just get ready to learn. To be honest with you, the workflows between each segment are very consistent and they stay the same. So once you learn how to do one, you can go in and explore and you'll be able to figure it out. It's very obvious, like, okay, if I click this, it's going to create a corrective action, which then I create this, right?
Sure.
Um, the setup with like the incident management automations and things like that, those those take a little bit of time, but again, it's like step through. So you start with the what pulls over from the incident, then you start with what investigation and what reporting requirements, and then it gets into, like what corrective actions might be needed or forced on this.
Hmm.
And so it kind of just step by step. It's taking you through the steps as it's helping you build, but once you built one, then you can go back and build them and apply them to all. And then you just have them available.
Sure, definitely. I know I got a question somebody asked earlier, Erica. And this kind of goes back to our discussion at the front half of the webinar, where things are changing all the time.
Uh-huh.
Joint Commission might throw out something at them tomorrow, next week. CARF might throw another thing. Their state might throw another change in there. After implementation, like, can they make changes
Mhm.
like on their own? How does that work?
Yes. Yes. At any time you can add in your own standards and make changes. Or say you need to revise your policy because your state put out things. So what you can do is you can actually resolve the policy and you can upload the new improved one and then
Mhm.
rescan it in check and it will using Policy IQ and it will redo and start. It's not going to delete your old data. It's just going to stop that appointment from continuing or that reminder from continuing. It's going to start a new one. Or you can even tie your new one into your old one, so that they're all continuing, but then it's just applying to that.
Sure.
And it will. So you can use that each step of the way.
Yeah. And then a follow-up question to that, can our customers, Erica, strike out some items, let's say, that don't apply to them
Yeah,
that are in there? How does that work?
absolutely. You're just going to toggle it to inactive. Super simple. It'll still be in the system. So I know some outpatients they don't need to apply all of the medication management.
Hmm.
Um, and so they go through and they just mark them as inactive. But then, 6 months to a year down the line, say they do want to now obtain Joint Commission for like, um, medication management by, improving their MAT or adding to their levels of care offerings. And you can just go in and toggle them back on. It's super simple.
Sure, definitely. Uh, I think another question that I get all the time, Erica, is in terms of users, is this limited to a number of users? How does that work?
No, there's no limit on users. So you can put as many users as you want into the system. Um, that there's no limit on that. As far as the sky's the limit. In fact, you're going to want all your Alleva users in there, at least for the HR files, so you can do
Yep.
your HR audits and automate that. But as far as you wanting them to have a user like access to in check, you can be very selective in who's able to see what pages can download what, can edit what, can delete what.
Right.
It's very selective and simple.
Follow-up question, does this determine my Joint Commission surveyor's mood when they audit me? Probably not. No. Can it control a surveyor's mood yet?
Um, I mean, it honestly depends on the day, right? If they're having a bad day, they're gonna get you. Um, uh, I know I it takes me back to a time where I we had a surprise like in DHCS in California, they can come in and do a surprise. We just opened a new facility and they can come in for the first year at any time because it's a probational license. And I had somebody show up and I was not at the facility when they showed up to do this survey. And I was like, I'll be right there. And I had just broken my leg. So I was in a full leg cast and she was not very nice to me on the phone. And then when I arrived, she saw that I was like legitimately injured. And she's like, "You came all the way from me." I was like, "Absolutely, this is important, right?" And her whole mindset shifted and it changed, and she was out of there in an hour. So it really just depends on the day. And if they
So
like you, I mean,
pro
it
tip,
changes.
put a cast on, right? With or without an injury.
Definitely would
Yeah.
not recommend breaking your leg
Yeah.
though.
We got another follow-up question on here. I know we got 3 minutes. Erica, does this cover all the states? Like, how does that work? Like, if they're in Utah, are they able to turn on Utah? Like,
Yes.
it does.
Yes. Yes, it does. So there's a state standard item for accreditation versus Joint Commission, and then also there's it varies. So you can, and then even if there's state, and then I know this has come up during some demos that we've had where you have state and then you have like Joint Commission, but then on top of that, you hold yourself to an even
Yep.
higher level. You can even add custom standards there. So you can
Mhm.
track them all separately. So you know that like your state requires like, I'm just using an example, one individual session a week, but you do two. So you want to track both. So you want to track that you're doing the one, but then you're also tracking that you're doing the two up here. You can have that there.
Sure. Gotcha. Um, Great. So it sounds like a person in Rhode Island can use this all the way to California, Massachusetts. So it is not state. It can be state specific, and it covers all states. Uh, Lastly, on here, Tyler S asks, "Hey, is there a catalog listing these items that I can present to the team for consideration?" 100%. So I'll actually go into my last slide on here. We will be sending a follow-up email with additional resources and information for anyone who wants to learn more about InCheck. And I think something I do want to say out loud, I think it's worth a demo no matter what. My team on the sales side will demo you guys as much as you guys want, no pressure of buying the software. I think it's worth taking a look at. We've gotten a lot of good reviews, and I think just as a reminder too, there's really no software out there that's like it. I think a lot of folks that I've been on calls, I've jumped on calls with, they don't realize what pain points they have around this until they see the system. They don't realize that they've been driving on the back roads this whole time, Erica. And then we jump on a call, show them the software. It's like, oh my gosh, I've been driving on the back roads. I didn't realize a highway existed to get things done, to help me out, to really help me clear the dust and help me understand and how I can take the next step towards compliance. So um, I know that comes up on here a whole lot, but we're coming up on time. I do appreciate everybody joining in on here. Like I mentioned, we will be sending out an email follow-up for anybody that is interested. If you guys are wanting a demo now, feel free to jump on our website and inquire for a demo. But shortly after, we will be sending over a follow-up email along with a recap video of this. It will be posted on YouTube. Erica, any last words from you?
No, I think it was great. Thank you for having this with me today.
I appreciate it. Thanks so much, everybody, for jumping on. We'll catch you guys at the next webinar. Take care, everybody.